Hello and welcome. My name is Dr. Maeve Kenningham from Dr. K's clinic, and today I want to talk a little bit about frown lines. That's a very common concern. Patients approach me to help them eradicate these lines. Now I have two treatment options for this area, one of which is a prescription only medication called botulinum toxin. You may recognise the terms Botox, Bocture, Azalure, Xeomin, Dysport. And this is it's a prescription only medication in the UK, and only medical prescribers can use it if they decide on taking your history that it's medically appropriate for you. The second treatment option, which I don't like to do as readily, is put dermal fillers in this area. Now, I don't like to do it because it's technically very challenging and somewhat a little risky, because often the frown lines appear in little crevices here and here, and interestingly it's just where the supratrochlear artery exits the skull and travels up into the forehead, and this tends to be the area that your skin creases at because it's accommodating the artery in this area. So I don't tend to do it that often at all. So we're going to jump on to see a little animation of me with the muscles of my face exposed, just so that I can explain a little bit more about how botulinum toxin works very well in this area. So here we have the muscles of the face. In particular, I want you to pay close attention to this, the glabella and the procerus and the corrugator complex. So these group of muscles act to pull the brows down and to bring them together. So it stands to reason if these muscles are injected with botulinum toxin, it causes the muscles to relax. And when these frown lines relax, the forehead muscles, they act in an unopposed way, so it has the advantage of a brow lift. So this takes about 2 to 3 weeks for the toxin to take effect, and it can last on average about 12 weeks or thereabouts. And some people, because their muscles are very strong in this area, it may not last the full 12 weeks. The good news is if you have this treatment by about a third occasion, these lines are either eradicated or they're much softer, and the other advantage is that you kind of get out of the habit of frowning so much. So if this is an area that bothers you, all you have to do is to get in touch with me. If you go along to my website, Dr. K's clinic, or just Google my name, Dr. Kenningham, and if you go to the contact me page, right at the top there is a booking button. And last of all, I'd like to thank Dr. Tony Burke for sharing her facial muscle app with us, with other medical professionals. I find it great to educate you guys as to what treatments there are out there in aesthetics for your particular concerns. Okay, I hope to see you again soon. Bye now.